Morning, everybody. I don't know how to follow that. You know, that was really bad planning. Certainly, I should have been watching out for that, for who was going to follow that. And actually, because of that, and I think we've moved the conversation on maybe slightly longer into the morning than we would have planned, and that's a good thing, because I think this is exactly the type of space. It's exactly the reason that we asked Karen Cross to build on yesterday's discussion, not to go over yesterday's discussion, but to build on that. And so what I'm going to do, because the main reason of the morning and today is you've listened to other people yesterday. We've had people speak from a north-south perspective. We've listened to people all across the portfolio. But actually, we want to get you talking today. We want to hear what you're saying. And we have people around the tables from the HRB today. We're not going to report everything back. We'd be here for like 5 days with you all. We don't have you for the weekend. But we can commit, as I think we always do in these grant holder conferences, to listening. Sharing some of our perspectives, but listening to what you have to say and going away and thinking more about that. So my colleagues will be taking notes at the discussions at the tables, because we're going to try and feed that back to you after the meeting today, and to other funders and to other partners, to see what came and bubbled up from our discussions today. And we have some questions that we've put on your table. There's no right question, there's no wrong question. It's just to get the discussion going, and we're going to be doing that. And we want to warm you up, before the panel discussion. It's also important to say that when we were thinking about this grant holder conference with this theme, and I think you can see why we picked the theme, no matter how you define it: collaboration, partnerships, structured, unstructured, community, researcher, non-researcher, knowledge user, whatever. This is our world now, and we have to figure out how to navigate it. Many of you are. We want to build on that. But as a funder, we're really interested in it. And we don't operate in a system outside of everybody else. So we felt it was really, really fitting, and we're delighted that many of the colleagues that we invited from government departments, not just the Department of Health, but other government departments, other funders, the research office teams, chief academic officers, the HSE are here today. They don't necessarily get direct grants from us, so we haven't taken our grant holder community literally, because I think one of the points that I just want to make, and I'm not going to go through the various slides that I had, because I'm not even going to attempt to follow that, and I want to move into the discussion, but we don't operate. We're grappling with how we operate, and both in terms of how we fund and what we fund, to support a lot of what we heard over the last 2 days, but also in the systems perspective that Karen has just touched on there. We work as part of the research and innovation system more broadly, and that collective knowledge society. We also have a very specific remit in relation to health. And we're trying to figure out ways, I think increasingly, of how we sort out our own national and interfacing north-south, particularly post-Brexit, maintain those links with our colleagues across the UK, and things are changing big time, post-COVID in the UK, and that's what we're trying to figure out. So I just am going to spend 1 or 2 minutes only, because I don't want to eat into discussion time from you. I really want to prioritise getting conversation going. But to pick up, I'm probably going to skip through items and pick up on the, and all these slides will be provided. I was interested, I put an interesting little snippet in there, and I'd love to hear your discussion, and I'd love to, to be having a conversation with other funders and with others across the UK and so on, and around research on research. We heard from Isabel. We don't know a lot about funding, about costs, about how we measure impact, about what's working, what's not. And actually, as a research funding agency that's very interested in research on research, we'd be really, really interested in teasing out some of these issues with you. But there is a growing body of evidence to suggest, maybe counter to the stereotype that you put up there, that female scientists are more likely to be engaged in interdisciplinary research, and it tends to be more senior and experienced researchers generally, whether you're multidisciplinary, interdisciplinary or transdisciplinary. I'm really interested in picking that and actually perhaps looking through our own funded portfolio over time and feeding back some of our thinking with you. So that's just a little, I won't even call it a factoid because it's just evolving evidence in that space. But what I really wanted to get into, just by way of building on what Karen has led us into and the point that Gian-Piero made, you'll notice that some of the questions around your tables are around how should we and how are we going to move forward in certainly that interface between academia and our healthcare system. And I think the timing couldn't be more right for us to have this conversation, because of course this is what's happening out there in the system. We have colleagues from the HSC today. There's huge work going on, and it's really, really welcome in relation to raising the profile, the awareness, moving on governance, trying to streamline things and so on. But at the end of the day, we've just heard about, like, when you have research offices and you have long-standing support in a university system, how are we going to move to have that and up the pace of that and support the endeavours that we all know needs to happen at that academic healthcare system interface? And you're probably all aware, and particularly most recently with the report from the chief academic officers, many who are in the room here today, you know, we've been talking about kind of academic health science centre or other models, and to basically look at that unified, coordinated infrastructure, pipework, strategies, and so on. And that's, for us in the Health Research Board, a main reflection is that that's where a lot of things are stalling. So that's why really we wanted to build this into a collaboration discussion, where typically it is taking where there are multiple institutions working on something, whether it be a centre, whether it be a consortia, whether it be a network, whether it be a biobank, whatever. Things that can take up to 2 years for a collaboration agreement between the partners. What does that mean for all of you? It's soul destroying. You know, and I was just interested in the losing energy, losing the will to live, losing partners. As a funder who's got an application in to do X, which is wonderful, and secured funding from our department and from government, those timelines mean that we're in danger of losing funding, because it tends to be large and capital funding and so on. And so we've kind of all gone with the vision, the needs, the energy, the enthusiasm, a great application, and then we're all put +2 years on it. And they're difficult conversations with our funders, our sponsors, and so on. And so we really, I know that's quite practical. It's quite like, you know, we talk about these structural governance issues and so on, but we really need to resolve this so as that we're spending our time then talking about what are the evidence priorities, who should we be working with, the difference it can make to patients and communities and to all of us. So I suppose I just wanted to put that out there and say there's loads of energy being spent in these discussions. There's loads of really good ideas. There's no lack of willingness. But a question I would put is, how do we all collectively try to move this on as a system and stop doing workarounds? And certainly from my take in looking at other countries that have done this, it is a purposeful, planned, structural engagement between department or departments working on the education side and in health, with dedicated policy imperatives, timelines, and incentives and funding and thinking about these issues. So I'm just leaving that hanging out there because I think this is an elephant in the room since 2002 when Making Knowledge Work for Health was published. And it's despite huge effort and thinking and angst and frustration by many in the room. And my final point, because it will be coming up on issues around the table, is research infrastructures are critical. And by this, I'm not just talking about the pipework infrastructures, but research infrastructures that we heard a lot of about yesterday. And that move to, there's now an assumption for international collaboration in particular that we have infrastructure, and that challenge should be how to work in federated networks. and I suppose a reflection as a funder working in a broader ecosystem is that actually we're involved in discussions around joining federated networks and so on of infrastructures, and we're going, crap, we don't even have the infrastructure. Or those, we realise they're not at a standard or at a level, or we don't have the principles or otherwise, to actually participate in those. I'm not saying these things to be negative, I'm just saying them, I suppose, to provoke maybe some of the discussion that we need to take in relation to that. And this is an example of it, where in Europe, if you're not participating, I'm going to use the example, if you're in kind of the space of omics, personalised medicine, translational, clinical care and so on, if you're not sitting around the table and working through ECRIN and IATRIS, which is the infrastructure for translational medicine, which Ireland isn't in, BBMRI around biobanking and so on, which Ireland isn't in, actually where Europe has got to is sitting around the table talking about the alliance of the three of those. They're taking the clustering approach because they're realising that actually it's now the interfaces of those infrastructures, and we're still having conversations about should we or can we join, or what would we do? And that is becoming really evident. Any of the big projects, any of the big programs, you have to work through these. And, you know, that fear, I would say there is a fear and a nervousness that we've talked about in the HRB, that actually Ireland is going to be left out. So we have to have a way of figuring this out. So I think it's fundamental, not just selfishly and parochially to HRB targets, but actually to government targets around evidence for policy, around international collaboration, around shared island work. The list goes on. And these are long-term investments. It's bigger than any one of us. And I think, you know, we require a really detailed and long-term analysis and a portfolio. Again, this is a reflection on what I see in other countries. And in that, looking again at the health system, it's going to be more obvious, our pipework that will work, if we move forward on that interface between academic and health system interfaces and look at that model, because that's an obvious place and those partners to bring into the table, because it's a very messy conversation at the moment. Funding, to be perfectly honest, it's a problem, but it's kind of the least of our problems. Because what we're finding is then when you argue for funding, things don't move, or they're not moving as quick as they need to do this. And I'm not going to say any more other than that, other than we haven't covered loads of stuff in this conference that we could have, like the importance and the critical nature of open science. And that's why funders are really encouraging you to have managed data, fair data, as open data as possible. It's why we have invested in HRB open research and so on. So there's a lot more that we need to do in that space, because it's critical to collaboration. And lest anybody, my final point is, lest anybody think that what we've talked about already is complex, that we're now, I think, at a point in Ireland, there's been a big shift post-COVID and in Horizon Europe, where Europe is taking a different approach to what they're calling partnerships, in this kind of mission and partnership approach. I'll be honest, we spend a lot of time, there's a lot of staff in HRB trying to figure this out. What does it mean? What should we do? And we're still perplexed by it. You know, we have conversations with SFI, we're chatting under Impact 2030, because actually we haven't quite figured out what our cross-sector, cross-government, because this is now about researchers, policymakers, community groups, private sector, regulators. We're expected to have a system where they're all convened regularly, touch base, make decisions, do things, come back, communicate. We haven't cracked the academic healthcare interface. We're a small country. We should actually have an advantage in some of these spaces. But we're still trying to figure it out. So I think this is something that you will hear a lot more about. It's important that we discuss these issues. It's important that we figure out who might convene, how might we convene, How can we communicate? How can we make decisions? Because actually we're now being looked upon for either member state designated nodes or centres, or actually a whole of Ireland view. And you're being asked, could you have your decision from Ireland by next week on this partnership? And you're going, crap, who do we talk to? How do we do this? Whose role is it? So we talked about it, interdisciplinary research, role ambiguity, if it's not clear, if expectations aren't clear, it leads to conflict, et cetera, et cetera. It's going to be exactly the same unless we figure out a way, funder to funder, department to department, how do we make quick and agile decisions for Ireland. Again, I'm not saying this to be negative, it's really just to say this is the system within which we're working at the moment, and not us alone, and which is why we have other funders and government departments and research offices and all of you here today, because actually this is the direction of travel. And like I said, I'm not going to go through that. My final point is, I know I said the last one was, you have questions around the table. It is now expected, I don't think we've ever dealt very well with this in Ireland, about, private sector, and how should they participate. We don't have a huge amount of experience of that in the Health Research Board, based on our remit. But actually something has to change, because actually we're not going to put these infrastructures in. We're not going to do the scale and the ambition of research that we need to do, and we're not going to be able to participate. And let's face it, many of you couldn't do the work that you're doing, and shouldn't be doing it without interaction with various private partners. I know we've talked about community partners and so on today, but I find when we're in Europe and elsewhere, we're not really able to say what Ireland's view on this is. What's our take? What's our values? What's our culture? What do we want? What feels like too much? I think patients tell us when it comes to data and so on, and they're actually very clear about and very upfront about having those conversations. We need to be having those conversations more ourselves, because actually we're going to have to figure out what our view is on a kind of a public, an appropriate, what we feel is an appropriate, right, public-private partnership model for supporting research collaboration. I've put health in brackets because we know it's really a big issue, when you look at health research, but I'm sure that's a more broader issue. So I'm going to stop at that, and I know that's been a bit of a whistle-stop tour, but I just wanted to build on, I suppose, what we've already been building on over the last number of days, where we've kind of moved from researchers and teams and various different types of interactions up to centres, collaborations, consortia, that collaboration at multiple levels. And I suppose, at the risk of making it overly daunted, I didn't quite go the world, the universe, and so on. But actually, that's what COVID asked us to do. It didn't even stop at countries. We went to continents. We went global. We had to. Many of you in this room were able to do that because you were networked, you were set up, you had systems, you had relationships. So it's not that we're not doing it and we can't do it. We want to learn from people in the room who've actually done that, what worked, what didn't work, all of that learning. So I think it's an ideal time to do that and looking forward. So for the next, she's looking at her watch, and I don't know how long we can maybe go on for till. But I think we'll go on to about 11 o'clock. And what we want you to do is, we've just mixed loads of questions up around the various tables. There are tables that have green numbers on them. And we just want, people who are not on a table with a green number, maybe move to one of the other tables where there's a green. It's just to have more people around the table, and there's a note taker at it. And use those questions as a guide. We're not going to chair the discussion, we're not going to facilitate it, but there are HRB staff at your table. They're going to be taking notes, and importantly, before you get stuck into the discussion, I'll just repeat, we will be looking to collect the feedback from all of this. We're not going to report it back. It's great, the conversation has started already. This is brilliant. Don't you just love Ireland? I'm going to call it at about 11 o'clock. Happy discussions, happy debate. And if you have any questions, ask the HRB people at your table. But if I could ask people to go to a table with a green number in the middle of it. happy debating and discussion.